Hi warriors, it's Hanne here and welcome back to another video. If you're new here, hi, I'm Hanne. I'm 24 years old, I'm a therapy care worker in a self-harm and rehabilitation unit, and I tend to post content around my lifestyle, what I eat, mental health and eating disorder recovery. If you like what you hear, definitely be sure to give it a thumbs up, to subscribe and to stick with me on this journey. Today, I'll be talking some more about my job. I've had a lot of requests about what my job is about, what I do, what my shifts are like, so I thought I'd address some of these questions in today's video. Definitely keep watching. So, first things first, what is my current job? Currently, I'm a therapy care worker, which is just a fancy name for a healthcare assistant. I can't talk about where or what exactly because of confidentiality, but what I can say is that I work with children between the age of 13 and 18 years old, and that is an extreme risk-taking and self-harm unit. I work 3 days a week, 2 15-hour shifts and 1 8-hour shift, and I've got my other days off. If you want to hear the specifics about my shifts, my hours, any breaks that I might potentially have and my pay, stuff like that, definitely let me know below and I might make a whole video on that too. In this video, I just aim to sort of give you a general overview of what I do, because there's a lot of things that I could discuss. If you're interested in any of the things that I don't manage to get around to though, as I said, comments are welcome. Anyway, I started in this job 6-7-ish months ago. It is an 8-bed residential, so it's not a hospital setting, but neither are these kids at home. They're in a place where they're learning to become a bit more independent. So what I do is help them with day-to-day tasks, drive them around, get them to get involved in activities, and provide therapeutic support and also crisis support, because obviously it's a self-harm unit. All of my days look very different. So on some days there might be a lot of playing games, taking them out for walks, doing activities with them, as well as obviously observations. So we have a sheet where we have to fill in our observations, obviously to see if they're all right and to know what they have been doing prior if they do self-harm or run off or anything like that. And then there's days where you're going in and out of A&E, then going to another hospital, then rushing back to another place. So yeah, as I said, no one day is exactly the same as the next. What do I like about my job? I like that I get to play games and chat and be sociable and do activities for a living. It's quite fun a lot of the time, and I really enjoy the colleagues that I work with, especially because we can go through quite intense things and I feel like you really bond that way. I also quite like the fact that I have 3 main shifts in a week and then can pick up overtime if I want to, but can also just be at home and work on my other hobbies and my YouTube and Instagram channels, which I'm really trying to grow at the moment. So if you haven't yet, please give it a like and a subscribe because it'll help my dream come true. Nevertheless, there's obviously some things about the job that I don't necessarily like all that much. The shifts are very intense and very tiring. Arriving at 7:30 in the morning and not getting home until 11 at night, especially if there isn't a break in that day, is frankly exhausting. Because there's often overtime going as well, it's quite easy to just overdo it and keep working and working. And even when I don't pick up overtime, I'll be working on other things. So I need to be really strict with myself in a way and do take some time off and take enough rest. The job is very taxing, so rest is needed. Finally, because it is self-harm, that in and of itself is challenging. Sometimes it's tough to not take things personally. For example, recently I was doing observations, I was going up every few minutes to check on the different girls in the house, and One of the girls was minding her own business. She seemed cheery, and the next time I came up, she cut. And yeah, it just made me feel really horrible because I thought, why didn't she tell me, or why didn't my intuition tell me that something was wrong? And sometimes you just don't know, and it's obviously not your fault that this happened, but sometimes it's difficult not to take things personally, and it's definitely a skill that you learn in a job like this. The job that I have is definitely a challenging one to go into right away because it is an extreme risk-taking facility, and some of the things that I've seen have really been extreme, and yeah, it's not for the faint-hearted. Anyway, all in all, I've really valued my experiences so far, and I feel like I've learned a lot. That is not to say that I'm sticking with this job for life, because I won't. I don't think I'd be able to mentally, but yeah, it's definitely taught me a lot about the mind, about people, about mental health, and about myself. I hope that at least answers some of your questions about my job. If you have any more questions, I will get to them really soon because I'm planning to divulge some more information with you, but leave them below, won't hurt. Be sure to like and subscribe, obviously, and keep your eyes peeled because I've got some interesting videos coming next week. And yes, I said videos, as in plural. Love you all lots. See you soon and take good care of yourselves.